To bring this exercise into a more dance-specific context, what you're going to do is assume a parallel passé position, and with the single leg pushing out, very nice, bring it back. She's still using her abdominals, but now what we're also doing is we're including some hip stability. So she's having to rotate her pelvis on top of her femur. So if she doesn't control that, what happens is it begins to pull everything in. So in order to keep everything stable, she's actually using her external rotator muscles and also staying lifted on that standing leg. So now you're getting your left glutes, you're getting your abdominals, and probably a little bit of shoulder activation as well. So in order to continue the specificity of the anti-rotation concepts into dance-specific movement, what we're going to do is apply the anti-rotation idea to a prep and a parallel turn. So what we are going to do is I'm going to have the TheraBand looped as such. Crystal is going to stick her arm through. I'm going to be pulling her shoulder in towards me. The TheraBand is going to wrap around close to the top of her hip bone, and I'm going to provide a little bit of resistance. So in this position, what this force is doing is that it's turning her in towards me. It's internally rotating the hip. And then we know that if there's internal rotation of the hip, you're going to see a lot of different compensations down the chain. Also, there's a little more rotation happening at the abdominal. So what she's going to do is she's going to think about rotating this back out, maintaining proper alignment, tripod in the foot, alignment of the knees, rotating out, spiraling out that hip, and then maintaining that abdominal stability to prevent me from pulling her in. So what she's going to do is she's going to give me a basic prep, and she's going to go up into parallel passé, boom, and down. So what we are doing with this is we are now trying to activate everything up the chain. So you'll note that if Crystal is not engaged and she gives into the force of the TheraBand, everything begins to pull in. So what we want to be able to do is fight that rotation. And this is a great way for people to begin thinking about how to incorporate your abdominals into turns. One more. And then you can also modify these for in a turned out position. One of the things here is you also want to make sure that as you're performing this exercise, you're not leaning into the band, but you are resisting the rotation.